Here are some comments on your case history. Okay, so title page. Great. Department of General Surgery. Head of department. No, that's not me. Head of department is certain other person. I am assistant of department instead of this one. It goes me. Head of department is other person. So passport data. 9 years. 9 years, that's a child we're talking about. Yes. Okay. It's going to be interesting thing. Home address. Delhi, India. Date of admission. Delhi Public School. Crickets. Seriously? Vitamin D dependent. That's an extremely rough surgical disease. I am really interested to find out what exactly are you going to operate in this patient. Okay, let's see. Complaints of a child. Bone tenderness. Green stick fracture craniotabes. What do you mean by that? That a 9-year-old child tells you, you know, doctor, I have bone tenderness, I have green stick fracture and craniotabes? Really? These are complaints? Skull bossing. Open fontanellis. Bowed. Yes, I can imagine that. A 9-year child says, doctor, I have open fontanellis. I don't know what to do. Please help me. Rachitic skin. What do you mean by that? Is this some certain type of skin? Or it is a symptom of something or what? So we except fever, we don't know a single complaint of this child. Caesarus attack tetany. It goes together with fever, or fever goes separately from number 1, 2, or it's related to number 2. We don't know, unfortunately. Blood circulation. Well, actually, after complaints, there must be history of present illness. Anamnesis morbi. Or maybe... Oh. Maybe these are complaints. Yes, I understand now. These are additional complaints. Okay, let's see. Blood circulation. Palpation. Are seen. What are seen? Where are seen? Palpation is seen. You can see him palpating his blood circulation system or what? I can't understand. Heartbeats irregularity. Arrhythmia is seen. How exactly do you see arrhythmia? He has some banner hanging over his chest, says I have arrhythmia, or what? No edemas aren't seen. Okay, let it be. Dyspnea. Pulsation of cervical vessels. What cervical vessels? Internal jugular vein? Or maybe vertebral artery? What exact cervical vessels? The only cervical vessels which can be seen pulsating are carotid arteries. Mostly external carotid arteries. So You had to specify if it is what you've meant. Head vessels and vessels of all other parts of the body except bone, skeletal bone. Vessels of all other parts of the body except bone, skeletal. Listen, this is just some sequence of words. They do not arrange even in half of sentence. I can't understand that. No cough, no sputum, hemoptysis not occurred. Yes, that's quite valuable information. No pain in the chest. Okay, great. Respiratory dyspnea very... Do you mean rare or rare? Respiratory dyspnea very... I can't understand that. Sweating. Normal. What do you mean that sweating is normal? He's sweating normally, or his sweat is normal, or he's normal while sweating? What is the meaning of those words? Acute fever with irregular interval. Okay, let's just make it to ourselves that he has fever. Breathing through nose, normal. Nasal bleeding not occurs. It's very valuable. Pain in the abdomen, sometimes. Diffuse abdominal pain with no relation. With no relation to what? Sometimes. How frequently sometimes? Once in a lifetime, or 30 times per minute, or constantly, or how long? No relation to what? This you do this once again. You just tried the sequence of some words. No relation with position. With position of what? With position of the patient, his parents, your position. With no relation to my position while I'm reading this. Not understandable. Hepatitis depressed. Okay, that's a good one. Meteorism. Okay. Excrements regular. Constipations, diarrhea. You mean that he has constipations and diarrhea, or he doesn't have constipation and diarrhea, or he has something else but not something other? Loose stool. Okay, that's a valuable sign. Let's leave it. No pain seen. How can you actually see pain? Are you some sort of wizard or sorcerer? You have some philosophical stone which projects pain in some magical spheres. How can you actually see pain? It's a secret to me. Increased ketone bodies in urine are seen. How exactly do you see ketone bodies in urine with physical examination? Do you have an integrated microscope in your eye, or you have some other magical stone which you pass to the unit with urine, and it shows you in a magical way that there are ketone bodies in this urine? I have no idea what you are talking about. Mood is not balanced. Sleep is improper. Okay. This is actually a sign of something. No loss of conscience. Okay. Let's leave it that way. Mild giddiness, general weakness of limbs. Skin itching. Toad skin. Skin, it's an abbreviation here. It's written from capital letters, everything, or what? Toad skin, it's a symptom of something, or it goes separately. What do you mean by that? That's some other game of words. Vision audition tasty normal. Okay, let's leave it that way. Osteomalacia. Bone are not regular and shapes. What bone? Some certain bone. If some certain bone, what exact bone? If you're talking about all bones, then you have to write down that all of his bones are under effect of osteomalacia, regular in shape and size. What is shape, size? What do you mean by that? You do this once again. It's just sequence of words. Symptoms started in a patient by birth. You mean that he was born with rickets? He has rickets and cause of disease is hypovitaminous vitamin D due to non-exposure of some sunlight. Child cannot have rickets by birth. This is not an inherited disease. Rickets gets developed during child's postnatal period. He cannot be born with that. So if you are talking about things you have no idea, like rickets, better read something about the disease and then start writing it in your case history. I still wonder what exactly are you going to cut off to this poor child to treat him rickets. He has rickets and cause of disease is hypovitaminosis D. Yes, in sometimes, yes, hypovitaminosis D due to non-exposure of sunlight. This child is 9 years old, and you say here that his symptoms started from birth. You mean that from birth he never was exposed to sunlight, or throughout his 9 years of life he had deficiency in sunlight? Do those parents keep him in a dungeon, or they've brought him to some basement after he was born and never ever let him see the sun throughout 9 years? Seriously? Are his parents some maniacs or what? Obstetrician anamnesis is found out in children younger than 3 years only. Why? Why do you think that you can't examine obstetrician anamnesis in children younger than 3 years? You can examine it even in children who are not born, in a mother who undergoes pregnancy. Why can't you do that? It remains unknown. Not found. Not found what? You don't know anything about the way he was born. You don't know how long the pregnancy lasted. Don't you know, was he born naturally or by cesarean section? Was he born using obstetric forceps? How long was the period of pregnancy in his mother? Was there some pathology of pregnancy like eclampsia or preeclampsia? Really? You can't know that? Why? This is some strictly classified secret, or some other reasons? I don't know. Number of the child in the family is only one. So this child, he is the only child. This woman, previous pregnancy was normal. Seriously? Yeah, really? Yes? Number of the child is only one, and previous pregnancy was normal. Tell me please, what was the conclusion of mother's previous pregnancy if this child is the only one? Who was born as a result of a previous pregnancy in that woman if this child was the first one? Maybe it was not a human. I don't know. Please explain me this passage. This is super. Let me find some golden color. Yes. This is gold. I've never seen conclusions or statements like this before. This is pure gold. Let's read on. The state of mother health during and after pregnancy is poor. She don't have good conditions of life. What do you mean as good conditions of life? Or maybe you can tell me who has good conditions of life. She didn't live in a mansion which was situated on the shore of Pacific Ocean. It means she had bad conditions of life? Or what? Or she didn't order food from fancy restaurant every day, and that made the condition of her life poor? What exactly? Normal delivery. Please explain me. If mother's health during the pregnancy was poor, how could she undergo normal delivery with normal duration? Normal delivery with normal duration results as the good, the proper period of pregnancy undergoing. It means that she did not have any pathology of pregnancy. So I can't understand this statement at all. Child's weight 2 kilogram and length of body at birth 44 centimeters? Seriously? This child is extremely undernourished. Children like that require intensive care. If those children get born, they go to reanimation unit instantly. They are attached to the machine for artificial lung ventilation. They are attached to multiple machines and drugs which maintain their life support until they get mature enough to breathe by themselves and to maintain their circulation by themselves. With congenital defect of bone, we already discussed that he cannot have the inherited rickets. This is not a congenital condition because rickets develops during a period when child's bones undergo ossification. A newborn child has lack of ossification of all his bones. That is why he cannot develop bone pathology which is relevant to rickets. Child is underweight. Yes, we can see that definitely. Child has been applied to breastfeeding within half hour and sucking is normal. Really? Tell me please, have you ever seen a newborn child in your life? anyone, just not on a TV, not in the movies, but in real life. Have you ever seen a woman feeding a child by her breast? In real life. How can you imagine a child whose weight is 2 kilograms and length of body 44 centimeters? How can he have normal sucking? No comments. Physiological weight loss is about 130 grams. Really? Maybe 1.3 kilograms? Umbilical cords, umbilical wound healed. Child discharged on 30 days after birth with weight 2.5 kilograms. If you discharge a child which was born with a weight 2 kilograms and length of body 44 centimeters, so if you discharge this child in 30 days after birth with weight of only 2.5 kilograms, the only place you can discharge this child is a graveyard, because children so underweight, they are not adjusted to to maintain their life support by themselves. In 30 days, at best, you can take him off machine for artificial lung ventilation. So please, before writing stuff like that, things which you just not don't know, you have absolutely not a single idea about how this happens. If you want to do that in further, please read some books about obstetrics, neonatology. Look at how a real newborn child looks like. Just primitive stuff. Figure out before writing that. Child is only 4 months. In the passport part here, it says the child is 9 years. So please, try to make up your mind how really old is his child. He's 4 months or 9 years? Neural and behavioral development, child is only 4 months. So, okay, let us imagine that he is only 4 months. You mean you cannot evaluate neural and behavioral development of a child who is 4 months? Really? Once again, please don't write and don't speak with faculty staff about things you absolutely have no idea how it looks like, how it works, and how it is originated. Natural breastfeeding. Yeah, really, with good sucking. We've discussed that already. Children's has skin infection. Not healthy. What skin infection? What part of his skin has infection? How can you tell that this is a skin infection? How do you define a healthy child's skin? What signs or symptoms led you to this conclusion? I don't know. Prophylactic immunization of child and mother according to calendar during pregnancy, after really? Child who is 2 kilograms, who has 2.5 kilograms of weight underwent immunization according to calendar? Really? And he died of tuberculosis? Or maybe he died of other diseases from which he was immunized? Really? You just you go on making my day. Tuberculin skin test negative. This child would die from tuberculin test. No allergologic anamnesis. Okay. No lethal disease. Why do you think that tuberculosis is a lethal disease? No infectious disease of who? What? No intestinal abnormality before? You mean that now he has some intestinal abnormality? No migration, okay. It means that they are not a risk group of coronavirus, maybe. Right. Oh, now we reach physical examination part. Status presence. Not good. What do you mean by that? There is no medical term as general condition not good. My general condition is not good while I am reading this. It has no relation to patient. This is not a medical term. Why do you start describing nervous system at the beginning? Pain in joint and is palpable. What is palpable? Pain is palpable or joint is palpable? Oh my god. Head normal size. What do you mean that his head is... Oh. Crickets. Yes, head. How can his head be of normal size when his fontanelli are open and he has osteomalacia and craniotabes? Please. Think about it. Facial muscle normal function. Gland of neck region. What gland of neck region? Salivary gland, or thyroid gland, or parathyroid gland, or maybe some other gland I don't know about. What is palpable? Infectious foci are seen. How can you see them? Do you have an integrated microscope in your eye? You see pathologic bacteria there, or maybe you see some clinical symptoms of infectious disease in his oral cavity. How can you tell that his mucous tunic has lesion? What lesion? What are signs of that lesion which you see? We don't know. Well, let's leave it. It's better than an amnestic part. Not perfect, of course, but still it can go. How can you tell that all his heart functions are normal by physical examination? Heart sounds are not rhythmic, and he has such tachycardia. You mean that this is normal? That if a patient has a non-rhythmic heartbeat, with a rate of 115 per minute. This is normal. It means that all his heart functions are normal. Seriously? Symmetry of pulse, okay. Pulse frequency is not frequent. Really? 115 beats per minute, it's not frequently? Pulsus magnus, okay. Pulsus magnus is not normal, but arterial pressure detection, we detected. Korotkov method, value is not fixed. What do you mean not fixed? The value on a device for measuring blood pressure is not fixed. Or maybe Korotkov's device for measuring of blood pressure is not fixed. What was the problem in measuring the rate of arterial pressure? Symmetry. Not seen, no hernias. Visible peristalsis not seen, okay. Hypotonic, yes, it might be. Sigmoid palpable, okay. Cecum. Transverse. Liver. Pancreas impalpable, impalpable. Well, that can go somewhere. You forgot digital rectal examination. Child's complaints, osteomalacia, fever, rickets, hypovitaminosis D. Okay. Okay, let's leave it. The primary diagnosis, but it's not primary, it's preliminary diagnosis. Rickets with vitamin D. Insufficiency clinically. Okay. No complications of main disease. Okay, now you proceed to the section of additional investigations. X-ray of what? X-ray of head, chest, foot, what? Blood test for what? For chorionic gonadotropin, or for alpha amylase, or for calcium, for what? Radiography. What exactly do you mean by that? Skin biopsy, for what purpose? Biopsy of what skin? From which region do you want to take a skin for biopsy? What do you want to find out? Wait a second. That's all? Patil, Puja, Vijay Kumar. Where is the explanation? Why do you administer those tests? Where are the results of these tests? Where is the differential diagnosis? Where is the final diagnosis? Where is the treatment section, including surgery? You are writing a case history in the Department of General Surgery about rickets. What exactly did you want to treat surgically in a patient with rickets? Why? For what purpose is this all about? I don't know where you've taken all this information which is not related neither to surgery, neither to common sense of a third year medical student, but it was not from the literature I've supported you and not from the video tutorial. So mark for this case history is 0.0 points. Congratulations.